Well, I want to shed a little bit of light on the OR in the OR realm itself and talk about, what it's like to be an OR nurse before we get into the meat of this episode. So tell me, how do you like being an OR nurse?
I am obsessed with the operating room. I think that is an understatement, actually. I did my one day as a student, and then I was so fascinated. I loved it so much. And at first it took a lot to get used to the mask. You're like, is this something I can do? And then the smell, and then all the equipment. It's almost like a kid in a candy store. You're like, could I learn all this?
Yeah.
Could I be an OR nurse? And you're literally participating in surgery. I can't, every day, even still when I go home at night, I'm like, every day I go to work and I get to help with surgery. And to me, that's insane. And I'm still giddy just talking about it. And I feel like the operating room nursing is kind of like a diamond in the rough. Not a lot of people know about it, but once you go to the OR, you're never leaving. It's even hard to just step into leadership positions because we're so obsessed with just being in the operations day to day and helping with surgery and almost like that instant gratification. As an ICU nurse, your process is so long, it could be months. And then you start to see small changes if you see changes, but that instant gratification of there's a problem and we're fixing it right away. It's so satisfying.
Yeah. Oh, I'm sure.
And it's almost like you feel like the people behind the scenes, you're no one knows we exist or what we do. And we're your biggest advocate when you're asleep. And to me, that's just, every day, you wake up in the morning and some people are like, I dread going to work. But for me, I'm like, I love what I do. So
that's amazing.
I'm like, I have to go to work. And it's just if you love what you do, you truly never work a day in your life. That's how I feel.
That's incredible. It's incredible to have that kind of perspective too, especially now, because so many nurses are burned out of where they're at.
Correct. And as far as the burnout in the OR, we'll never have more than one patient at a time, ever.
Yeah.
And sometimes there's 8 to 10 providers for that one patient.
Yeah.
And so sure, we maybe will work overtime and do more cases than we normally would in a day, but you're just, can you truly burn out when you're just doing that one-on-one patient care every single day? It's
a different type of stress, I'm sure. It's great that you can just shift all of your focus into everybody is focused on this one person at the same time. And it's if it goes longer than it needs to, too bad. You're not gonna, run through people
you just lose track of time. Even when I go, one of our things that we do as an OR nurse is a pre-op assessment. We have pre-op nurses, but you're always checking and double checking all the work. You have a list and you cross the T's, dot the I's. But, one of my things when I go in there, I'm like, are we late? I'm like, I don't know what time it is. I don't know how late are we early? I'm sorry. But it's kind of like a, mood changer when I'm trying to come in and, accommodate and maybe make a joke. Because as you know, as an OR nurse, you have about 4 minutes to win over your patients or in pediatrics, your patients' families.